name is Anna DeLobo. I'm a licensed acupuncturist. I've been in practice since 1999. I practice in Laguna Hills. You can read about my work at moveyourqi.com and also at blog.moveyourqi.com. Today's testimonials are going to be regarding PCOS, which stands for Polycystic Ovarian Syndrome. There are two testimonials that I would like to read to you today. One is regarding a woman who is in her late 30s who is not trying to get pregnant, and the other one who was trying to get pregnant and now she is pregnant. The first one: Dear Anna, my endocrinologist has been treating me for PCOS for the past year. During last week's visit, he said my blood work showed huge improvement. My androgen hormones have decreased. I was originally put on 2 medications. About 3 months ago, I stopped taking one of the medications. During last week's visit, I was told to cut the dosage of the second medication to half. He felt that there was no need for me to see him again. He advised me to have my family doctor redo blood work in about 6 months. He believes the hormones will continue to balance and become normal. At that point, I can stop taking all medications. His comment to me was, whatever you have been doing, keep it up. I have been receiving acupuncture treatments from Elements in Harmony for about 5 months. Thank you, Anna. This patient is anonymous. This patient has been very consistent with her treatments. I'm happy to say that this particular patient has not been doing any herbs, just acupuncture. And we've also created 90% improvement with her digestion, and she also doesn't have this pain from scleroderma that has been in her middle back for the last 2 years, and so she has graduated from her mid-back pain. And I'm very happy about this particular case because my other PCOS patients are trying to get pregnant, and this is one particular case where she has PCOS and she's just trying to get healthy, and we were able to see just what acupuncture can do. She used to be on 2 medications, and now she is down to just 1 medication, and of that 1 medication she is now down to half the dosage per her doctor's request. And again, the endocrinologist requested that she no longer see him because there is no need for him to see her again. She can just go to her primary care physician and have her blood work checked with her physician, her primary care physician. And in case you don't know exactly what just happened there, basically our treatments allowed her testosterone level to decrease and her female hormones to increase, the progesterone and estrogen, because usually what the problem is the male hormone in the female is elevated and the female hormones are lowered. So her hormones, according to her doctor, are balancing, and we are very happy about that. And she is continuing with her treatments so that maybe one day she will no longer have to take the medication for PCOS. And I can't wait to publish that. The second testimonial is from Tricia, and I'll just read it to you and I'll talk a little more about her condition, her case. Dear Anna, I'm sitting here 16 weeks pregnant, elated and still a little shocked that our 3rd child is on the way. Without your help, who knows where I'd be? I came to you in August 2008 with a diagnosis of PCOS, which only manifested itself in the form of extremely irregular ovulation, periods, and bothersome spotting. But it did interfere with my life quite a bit, and I feared that should I ever want to get pregnant again, I would have a difficult time. Acupuncture and herbs proved to be the only effective and natural treatment option for me. You stressed the importance of consistency and herbs for my particular situation, and I'm glad I stuck with it. The entire 7 months that I stayed consistent with my treatments, I cycled every 35 days, which was unheard of for my body. Though life got busy and I stopped seeing you regularly, I continued on to 2, sometimes 3 herbal formulas that yielded great results. Those herbs are powerful. I believe in them with every fiber of my being. Of course, I would fret about the extra costs, but in the end, I decided that I would rather treat the underlying hormonal imbalances that way than through some band-aid remedy thrown at me by a medical doctor, i.e. Clomid or synthetic hormones. Anyone out there considering acupuncture for fertility, please try it and commit to it before you head to a fertility specialist who will force your body into extreme processes it's not ready for. The beautiful thing about acupuncture is that there are no side effects except increased energy, sounder sleep, improved libido, and on top of all of that, you're bringing the body into homeostasis, which is, in my opinion, essential for conceiving and growing a baby. Well, I happen to have a completely normal cycle in July, 30 days, that ended after 5 days of healthy bleeding. Unfortunately, the bleeding resurfaced in the form of brown spotting that lasted 10 days. I finally decided to call you to see if I could clear it up. I had one treatment on a Saturday, and not only did the spotting stop immediately, I ovulated and got conceived that Thursday. So here I am. In a nutshell, acupuncture and herbs regulated my hormones, brought on more frequent and stronger ovulation, and gave me fertile quality cervical fluid that I'd never produced before. I do have PCOS and have conceived all 3 of my children naturally. I can't say enough positive things about your ability to heal and the wonderful effect your treatments have on fertility and pregnancy. Thank you so much. Tricia. My notes in my emails, and if you read it on Facebook, I stated that I treated this woman starting in August 2008 specifically for fertility. She had her menses 75 days apart. I requested that she give me 12 to 18 months in order to help her get pregnant due to the severe nature of the PCOS. She received acupuncture and was on 2 to 3 herbal formulas a month. She informed me of her pregnancy in September 2009, so that was 11 months later. Please refer to my website on moveyourchi.com. Trisha wrote quite a few other testimonials that are posted on there that explain many of the other benefits that acupuncture and Chinese herbs have done for her, not just for her hormones, but for other issues as well. I'm very grateful for both of those testimonials, the anonymous one and from Tricia. Acupuncture and Chinese herbs are very helpful for polycystic ovarian syndrome. Tricia's opinion is that she'd prefer natural pregnancies. In my practice, if a woman really is desperate to have a child, then please go see a fertility specialist, and hopefully one that works with a licensed acupuncturist. I prefer to help my patients get pregnant naturally, but I'm not the one in the woman's shoes. So if you really want to get pregnant, acupuncture can definitely help with fertility specialists. You can read a lot about that research on my website, and especially on the blog.moveyourchi.com. Just look up fertility and Chinese medicine, and it'll show that IVF success rate actually improves by 65% when used with acupuncture and hopefully Chinese herbs as well. If you have any questions, please give me a call, or you can go on my website. You can email me. I'm happy to answer any of your questions regarding PCOS. This topic has actually gotten a lot of attention from not just patients and potential patients, but also from my colleagues around the country who are dealing with PCOS patients. So if any of my colleagues are out there, licensed acupuncturists, and you have any questions, for whatever reason, I am attracting a lot of PCOS patients right now, and we're making great results. Of my 5 patients who are pregnant right now, 2 of them have PCOS, and the other women who don't have PCOS, that doesn't mean that it's not as hard, because fertility in general is difficult to treat. I choose to not specialize in it because most women are very impatient in trying to get pregnant. I myself am pregnant with my 2nd child, and for me it didn't take a long time. Since my last child, I have been treating myself for the last 5+ years in order to get myself ready. And before I had Angeline, I prepared myself in order to get ready in a natural way. These were both natural pregnancies, and that's what I believe in. But of course, I work with women who are seeing fertility specialists, and I just hope that the route that you're taking is what you feel is best for you, and what you feel is what will make you most healthy, and above all, the most healthy and happy baby. So thank you so much for watching. I look forward to receiving your emails, your comments, and receiving your phone calls. Thanks, God bless, and you have a great evening. Take care.